got joining me now Lord Norman Warner, former Labour Health Minister. Good morning to you.
Good morning.
What are your thoughts on this? You know, at the end of the day, look, I was a junior doctor. I completely understand the position they're in. It's a really tough job. You're not paid particularly well. There aren't enough junior doctors, and I completely understand they're venting. We don't have enough. We haven't trained enough for many, many years. That is finally being addressed. But at the end of the day, the people caught in the middle of this are the patients.
That is unavoidable, I'm afraid. I mean, if you have a dispute of this kind, I can't remember a dispute of this kind going on for as long as it's gone on, and the two parties not meeting to actually try and thrash it out. Now, the junior doctors are willing to meet. The person who's not willing to meet is Steve Barclay. And I think this is really a question of now who trusts who. And I think the medical profession have lost trust in this government. So I'm not making a political point, but you can't run a health service with the doctors in that health service in strong opposition to you across the piece. It's not as though other bits of the healthcare system, the GPs, the consultants, are all happy bunnies. They're not. So we've got a situation in which really the relationship has simply broken down. And unless that relationship can be repaired, and there's going to be another test, there's going to be a test of whether the government accepts the pay reviews bodies for the next year. So, I mean, if that is still hanging around, and the Prime Minister and the Chancellor are going to have to make up their mind on that, if they don't actually accept the review body's recommendations, we can expect these strikes, I think, to go on.
And just in terms of that, so Sunak, I think they're going to come back at about 6%. And now Rishi Sunak now allegedly is considering that, but I mean still 6% would be polls apart from 35%. But at least he could say the independent pay review body is coming back at 6%.
I don't think this is about the doctors really thinking they're going to get 35%. They're not stupid. But what they're looking for is some commitment about the longer term arrangements for fixing pay. And at the moment, we've created a situation when these guys and gals are actually open to offers from anywhere else in the world, Australia, the US, and we lose them.
I think also, just from my own personal experience, the big problem also is your capital outlay as a doctor. You have to pay a lot of money to train as a doctor. And then when you go into the service, and most of them go in because they have a desire to help people. And of course, it's incredibly expensive to get there. You're not remunerated particularly well, and you're not actually valued. And I think that's the key here as well. For me, it's not just pay, it's conditions.
I agree with you entirely. I mean, some of the working conditions are pretty awful. If you go around some of the hospitals, the dilapidated state of some of the hospitals is quite appalling. So there's been an underinvestment in their working environment, not just theirs, nurses and some other staff. So you've got a situation which has been, I think, built up over 10, 12 years. And you can't fix that overnight. And you've got to break down in trust. I think unless the government accepts the pay review bodies across the piece for public sector workers, we're going to have a very long and difficult winter.
Do you think the junior doctors would accept that if it comes in at 6%? I mean, if they're asking for 35%, that's a heck of a backtrack, isn't it?
I think it would actually help the mood music. I mean, we need something to help the mood music. The government tried last week to try to improve that mood music with the long-term workforce plan. It didn't work. I mean, I think it crashed because it held the attention for about 2 or 3 days, and it didn't bring a change of mood. It didn't. The medics, the nurses, the others didn't all stand up and give 3 cheers and say we're moving into a new world.
No, indeed. And I'm just looking at my numbers here. We're short of 12,000 hospital doctors. And for me, the biggest problem, and you're right in terms of retention, 25% of doctors leave the profession after year 1. What a waste of their training. And I think one of the other things is that the barrier to going into medicine is far too high. My biggest concern is we're not attracting the right people into medicine. And if you are from an impoverished background and you have empathy, it's very difficult for you to become a doctor.
I agree with you entirely. I mean, the French, for example, take fewer years to get their doctors registered. I mean, that's just a fact. And we've basically got a 7-year term to train doctors. Now, I don't think, for example, you need a 7-day period to train people who are going to be a GP. I mean, a GP, I'm not denigrating GPs, but they are not specialist doctors.
To fight the GP corner, so the way you become a GP is you go through basic medical training of 5 years, then you go into your additional training. So, in fact, the training for a GP is actually far, far longer. I would say anything up to 10 years. But I would also argue their case, and many of my friends are GPs, actually you have to be a really good GP, you have to know an awful lot. You are very, very, very much on the front line.
I agree with you entirely. I am a fan of GPs. When I was a health minister, I always went... The GPs were the go-to people if you wanted to get something done. I mean, they really were. But I think we could actually be producing people as perfectly competent GPs, perhaps working under a bit of supervision, much faster than 7 years.
I think we need... Sorry, yes.
We need some radical changes in this area.
I couldn't agree more. We need radical changes and we need some blue sky thinking. Thank you very much indeed for your time. That's Lord Norman Warner, former Labour Health Minister. That's the junior doctor strike, which has started now 30 minutes into this very long strike indeed. After the break, we'll be talking about the economy. We'll also be looking at the UK's GDP, also looking at mortgage payments. How much more are you going to have to pay? Also, Britons apparently are going to be £25,000 poorer. This is TalkTV.